My name's Professor Louise Ackers, Chair in Global Social Justice. I'm a social scientist, but I work across social science and health. International collaboration, or what we quite often call in the work that I do, is international health partnerships. They're essential really to make sure that the research questions we identify are ones that are relevant to people living in those countries, not just ones that we've thought up here. There's a couple of underlying generic drivers to everything I do. One of which is to find more effective and less damaging approaches to international development. We want to try and reduce reliance on overseas development aid and some of the consequences that go with that. And we've developed the first ever rehabilitation service in a Ugandan public hospital for people who have lost limbs. Most of the limb loss now is a result of road traffic accidents, but increasingly domestic violence. We don't believe in setting up parallel services in private sector or in the NGO sector. So we've supported the development of what we call the Nsima Rehabilitation Centre, named after a lady who lost both her arms as a result of a domestic violence attack. And we've been really working here with our prosthetics and orthotics team in Salford to look at what kind of support we can give to people like Nsima. We're really focused on trying to improve the public health system in a way that is sustained and sustainable. The other area that we're working in at the moment is on maternal sepsis, reducing the number of women that die as a result of post-caesarean section. One of the ways in which we've been able to save the lives of many mothers in Uganda, we've made something called honey gauze. So we're using local honey and simple gauze, which are put on the wounds of women who've had a caesarean section. And that process of real back to basics wound care and the use of a local product like honey has actually proved to be a hugely effective antimicrobial stewardship tool. Simple interventions that can yield a real impact. So I think social science knowledge is very good at building connections and making things work. In that respect, the work that I've been doing in the low resource settings has really empowered me as a social scientist to actually see the value of the contribution that social science can make to social change.